CEO at the Whistler Chamber of Commerce. I would like to begin by acknowledging that we are having this virtual meeting on the shared unceded traditional territories of the Squamish and Lillooet Nations. We honor their language, culture, and traditions. I would like to thank all of the Pemberton, Squamish, and Whistler Chamber members for your continued support. Our chambers receive through your annual membership and commitments, enabling us to do the important work that we do to support the business communities in the Sea to Sky. Thank you to my colleagues, Louise Walker, who is the Executive Director of the Squamish Chamber, and Meredith Kemp, who's also the Executive Director with the Pemberton Chamber of Commerce, for allowing me the honor of hosting today's session. In collaboration with the BC Chamber and the Sea to Sky Regional Chambers, we have partnered with WorkSafeBC to bring you today's session on workplace health and safety during COVID-19. WorkSafeBC is working to support the direction of public health agencies for slowing the progression of COVID-19 by helping workplaces in all industries take appropriate preventative measures. WorkSafeBC has collected vital health and safety information about COVID-19 and the workplace, including returning to safe operation in phase 3. So today, as we can see, everybody's on Zoom. We will be taking your questions at the end of Chris's webinar and session. And so to use Zoom, if you haven't yet done so, at the very bottom of your screen, there's an area called Q&A. Just pose your questions directly in Q&A. And you can do this by just clicking on that, typing in your question, and you can also hit the like button to upvote a question, which will then be automatically placed as the most voted and placed at the top. So Chris will be doing a presentation. At the very end of the presentation, which will be about a 45-minute presentation, we'll jump into Q&A, and I'll moderate that at that point. So now it's my great pleasure to introduce you to Chris Bach. Chris is the Director of OHC Consultation and Education Services at WorkSafeBC. Consultation and Education Services serves the workers and employers of BC by positively influencing health and safety behaviors and disability management practices through partnerships, consultation, and outreach. Chris has been with WorkSafeBC for 6 years, and before moving into the director role, Chris managed the manufacturing and retail portfolio, as well as construction portfolio in consultation and education services. Prior to WorkSafeBC, he held various leadership positions in health and safety and disability management, primarily in the healthcare industry. Chris is a Canadian certified professional ergonomist, I think you were talking about, Chris, and holds an MBA from Royal Roads University. So it's my great pleasure now to pass it off to Chris, and you'll hear from me in a few minutes.
Awesome. Thank you very much, Melissa. And it is ergonomist, yeah. And
I did
it's always a tricky one for people to say, so no big deal.
Great.
So it's a great pleasure to be here today. I want to thank all the chambers.
We lost you, Chris. Oh, I think we lost you, Chris. Are you there? I'm going to put myself back on here. See if Chris, I know Chris was using his laptop earlier this morning, so hopefully we'll get him back in just a few minutes or a few seconds. Stand by.
Okay, I'm
there you are. Okay.
I'm not quite sure what happened there. Yeah,
welcome to the
I'm not quite sure what happened.
Technology, right?
Exactly. Yeah, my apologies. But here, let me share my screen again, and just give me a sec here, and then we'll get the screen on. So hopefully,
I have your slide deck. I'm not sure that I can go through your slide deck for you.
Yeah, fair enough. Can you see that first slide there?
Yeah, that's great. Yeah.
Okay, super. Excellent. Thanks, my apologies. Not sure what happened there. So good morning, everyone. And thanks to Melissa, and thanks to all the chambers along the Sea to Sky in hosting us today. We've done a number of these. I think I'm up to about 40 or so of them that we've done over the last number of months, and we've really found it to be an effective way of being able to provide some some guidance and some assistance to employers throughout the province, and help with any challenges that you might have in putting together your COVID safety plan and being able to either resume operations if you've been shut down for a while, or continue your operations in a safe manner. So what I'm going to do today, as Melissa mentioned, I'm going to spend about 45 minutes or so just going through what you see on the screen there. We'll start with just a really brief understanding of COVID-19. Won't spend a lot of time there because I'm pretty sure everyone is familiar with what's going on. Then really we'll spend the bulk of the presentation getting into points 2 and 3 in terms of how you can develop your COVID safety plan to control the risk of exposure in the workplace. Show you where you can get some industry information specific to your industry or something that's closely aligned with your industry. Other WorkSafeBC supports that we have, including the approach that our officers are taking as we're out there doing inspections, and then we'll open it up for Q&A after that. So just really to start off with a brief understanding of COVID. I don't need to go through all the details that are on this slide. I think people are familiar with what the disease is, what the symptoms are. But I really want to focus in just as one point of context, that point in the bottom left-hand corner of the screen that says that symptoms can range from mild to severe and can appear up to 14 days after exposure. And it really is that 14 days after exposure that creates some of the challenge with this particular virus relative to others like the cold and flu, which have a much shorter incubation period, in that people can be spreading the disease for a long period of time without showing any signs or symptoms of the disease. So when we think about control measures that employers are putting in place, your control measures need to be fairly broad and not just focused on symptom recognition. That is one piece that you do need to think about for sure, but you may have seen in the news that from other employers who are thinking about using thermometers and temperature checks, heat sensors, things like that, to be able to pick up on fever and pick up on body temperature. And if an employer is only considering that as a control factor, then you're missing a lot of the potential risk, because again, people can go 14 days without showing any signs of symptoms, without having that fever, that increased body temperature. And besides that fact, there are some people that just run warmer than others in terms of their body temperature, and also may have other things going on within their system that causes their body temperature to be higher. So it's not necessarily a reliable measure or a reliable indicator of the disease. So important to think about the fact that it is a 14-day incubation period, potentially up to 14 days for individuals. The other piece I want to talk about here is just really an understanding of those transmission factors, those factors that increase the likelihood of passing the disease between people. And if you have an understanding of what these factors are, then it makes it much easier to be able to then relate that or translate that into the control measures that you put in place. And the first one is around challenges maintaining 2 meters of distancing. And what you'll hear me talk about this quite a bit throughout the 45 minutes is that it really is the contact between people that is the highest risk of transmission. So if you have challenges maintaining 2 meters of distancing between people, that's where you're going to want to focus most of your thought around control measures in the plan, and we'll get into that in more detail later. The second point there, high frequency of unique people in the workplace. By unique people, we just mean different people. So if you're in an office setting and you don't have the general public coming into your office setting, maybe you're a small office of 10 people, really it's just those 10 people that you interact with on a daily basis that are potentially increasing the likelihood of transmission. Whereas if you are a retail setting or a restaurant or a tourism outfit, you got the public coming in all day long. And the larger number of people coming in for extended periods of time will increase the transmission. Potential to work in enclosed areas. So we know that outside is better than inside, and when you are inside, bigger space is better than smaller space. Now, if you have the opportunity to work outside, that's great. With inside settings, though, many employers aren't going to have control over the overall size of their space, but you may have some control over how that space is oriented. And again, we'll talk about that a little bit later, but the flow of people throughout your space can definitely be used as an important control measure when you have tighter area within your building, within your business. Potential for sustained group interaction. So the thought here is that the longer people are together in one place, the more likelihood there is for transmission. So, for example, if you are a server in a restaurant and you are taking orders and then delivering the food, that interaction is actually quite short. So particularly when you're taking the order, you can stand away from the table, you can ask what they want, maintain that 2 meters. When you're delivering the food, you may get closer than that 2 meters, but it's for a very short period of time, maybe a few seconds at the most. Whereas if you are in a construction site and you are erecting a crane, for example, you have to work within 2 meters of someone for hours on end while you're doing that, that sustained interaction is much more pronounced, obviously, and that does increase the likelihood of transmission. And this is really what plays behind the mass gatherings piece, is not having, gatherings of more than 50 people in one enclosed space, because the likelihood of transmission will increase. Probability of infected people. So this really speaks more so to healthcare or other settings where you may have a higher likelihood of people who have COVID to be in those settings. So healthcare is the obvious example here, and that would increase the likelihood of transmission. And then inadequate self-isolation practices. And that is mostly around ensuring that you have, as an employer, you have policies in place that if people do have signs or symptoms, or if they've been out of the country, that they're not allowed into the workplace. And we'll talk more about that as we go forward. Now, around surface contact, when we talk about surface contact, we talk about those surfaces that are regularly touched by many people throughout the day. So, we're talking about door handles or the light switches, or maybe the credit card machines, countertops. Those items that are touched infrequently throughout the day aren't really considered to be high risk. So we get questions a lot about in a retail setting, in a clothing store. If someone tries on a sweater, do we need to quarantine that sweater for 2 days before we put it back out on the rack? That's not something we're recommending at this point in time. We don't feel there's high risk there. There isn't the likelihood of a large buildup of virus on the surface, and the chance of that then transmitting over to another individual is minimal. So we're not really worried about that type of transmission, but the surfaces that are touched a lot throughout the day, washrooms, I mentioned the door handles, things like that is where you want to focus some of your efforts. And again, we'll get into the control measures in a moment. Now, if you do have anyone coming into your workplace that is experiencing signs or symptoms, any workers, then they should be immediately informing their supervisor, physically distancing from their colleagues, and then leaving the workplace, and then seeking medical advice, 911 if it's urgent, 811 if it's not, and following the direction of the healthcare providers. As an employer, if someone on your team leaves due to signs and symptoms and ends up going through testing and has a positive test for COVID, then as an employer, you will also follow the direction of the provincial health office or the healthcare provider in that particular situation, and they will do contact tracing and they'll ask you questions. So that's not really something WorkSafeBC weighs into. It's really following the direction of your local health officer or provincial health officer in those situations. So let's get into the bulk of what I really want to talk about, which is the development of your COVID safety plan and developing that plan to help control the risk in the workplace. So the order that was written by the Provincial Health Office on May 15th essentially states that every employer in this province is required to have a COVID safety plan. Now, I do want to talk about what do we mean by every employer. There are some caveats to this. If you are federal jurisdiction, so some examples of federal jurisdiction might be the airlines, might be some truck transport that goes into provincially, rail, even out on the water, some boats. There is some aspects that fall in federal jurisdiction, and in those situations, you aren't required to have a COVID safety plan. So this would essentially apply to every employer that needs to be registered with WorkSafeBC and fall under a prevention mandate. Now, if you're unsure, then it's best just to call us, and I have some phone numbers later on which I can show, which I'll post on a slide, so you'll have those phone numbers. But if you're unsure, call us. But if you fall under federal jurisdiction, you aren't required to have a COVID safety plan. Now, the other example that I use is owner-operators. So a bed and breakfast, for example, if you're a bed and breakfast, say a husband and wife couple own a bed and breakfast, they don't have any staff, you're considered an owner-operator, you're not required to have insurance through WorkSafeBC. You can opt for personal optional protection through WorkSafeBC, but you're not required to have it. And therefore, you don't fall under our prevention mandate, and you're also not required to have a COVID safety plan. So again, if you're unsure, give us a call and we can clarify that for you. Now, the other piece about the COVID safety plan is that you are required to post it. And it needs to be posted and available to your workers. It needs to be available to any service providers or contractors coming into your work site, and it needs to be available to the general public or anyone else, any of your patrons or clients that may be coming into your workplace. Now, you may have, if you're a large organization or a complex organization, you may have quite a robust plan. Maybe it's 20, 30 pages long in a document somewhere, in a binder somewhere. It doesn't mean that you necessarily need to post that 20-page plan to your front door. You could have a summary of sort of at a high level the protocols you're putting in place on the front door for the general public. But in the end, it is your responsibility as an employer to post that plan. The last point I want to make on this slide before I move on is that there is a perception that employers need to send their plan to WorkSafeBC and have WorkSafeBC approve that plan or endorse that plan before you move forward. I can tell you that that is not correct. We do not want employers to send us their plans. We're not reviewing or approving plans. We're not endorsing plans. We also don't have capacity for that with 300 officers and 250,000 employers in the province. We would become a bottleneck and business would not be able to get off the ground as quickly as we need them to. So it's not something that you need to do. Now, having said that, if an officer comes and knocks on your door to do an inspection, it is expected that you will show them your plan and they will ask to see that plan and they'll ask to see if you've gone through the 6 steps, which I'm going to outline in a moment. So just a bit of context there that you don't need to send us your plan. Now, as you're putting together your plan, first and foremost, you need to understand the orders, the notices, and the guidance that have been issued by the Provincial Health Officer and the BCCDC. So I mentioned the order that was issued on May 15th related to having a COVID safety plan. If you're in a food services establishment where you serve alcohol or food, there is also an order specific to that group. So you need to be familiar with what's in that order because it is law. It is a requirement for you to follow what's in those orders. And there may be other orders on there that may be applicable to your place of business. Best is if you just go onto Google and type in PHO orders. It'll take you right to the page and you'll see all the orders listed there in chronological order on when they were posted and provide you with that information. So understand that first. It's really important that you go there before you start putting together your plan. And then really it comes down to the basics of physical distancing, cleaning and hygiene, cleaning and disinfecting, and personal hygiene. Now with the personal hygiene, we're really talking about covering your mouth and nose with disposable tissue or the crease of your elbow when you sneeze or cough. Washing your hands often with soap and water for at least 20 seconds. So we do know that using soap and water is the single most effective way of reducing the spread of the infection. If you don't have soap and water available, you can use alcohol-based hand rubs, otherwise known as hand sanitizers. But you need to ensure that your hands are clean before you use those hand sanitizers. If you have mud or grease or dirt all over your hands or food all over your hands, the hand sanitizer is not going to be effective in neutralizing the virus. You need to have your hands clean. If you don't have soap available, that's fine, but you can at least run them under water, get as much of that grease and dirt off as you can, and then use some of the hand sanitizer. And it's the same with disinfecting surfaces. If you've got dust and grime all over a countertop, spraying a disinfectant on there and wiping it off is not going to completely neutralize the virus. You do want to at least wipe down the counter before you're spraying any disinfectant on the virus to have the best effect on neutralizing the virus. Also avoiding touching your face, your eyes, your nose, your mouth with any unwashed hands, and not sharing any food, drinks, or utensils or other things. And I'll get into that in a little bit as well. So then what does the plan look like? We have outlined a 6-step process in developing your COVID safety plan. And we have a template for this. I'll show it to you when I get to the end here. And I'm going to walk through these 6 steps. And step 1 and 2 really create the bulk of your plan and will probably likely take you the most time. The first is assessing the risk. So where are all the possibilities in your workplace where there could be exposure to COVID? And again, focusing in on where those factors I talked about earlier, where people are coming closer together than 2 meters, highly touched surfaces, sustained interaction, those types of things is what you really want to look at. And first identify where all of those areas are. Step 2 is then implementing control measures to reduce the risk. Once you've come up with those control measures, then step 3 is developing policies to manage your workplace. So policies and procedures to support the control measures you put in place. Step 4 is developing your communication plan and training. So ensuring your workers are aware of the plan and that you have gone through any training that's necessary for them. Step 5 is monitoring the workplace. This is really your plan, do, check, act approach. So not just developing your plan and putting it off to the side and then carrying on, but revisiting your plan on a regular basis, particularly in the first days and weeks of having that plan in place, getting input from staff, what's working, what's not working, what new information might there be from the provincial health officer that you might need to implement into that plan. So really that plan, do, check, act approach, that continuous improvement to the plan is really important. Step 6 is a bit removed from COVID, but it's an important step here, particularly for those businesses that are resuming operations. If you've been shut down for a couple months and you're just starting to resume operations, you may have machinery that typically runs 24/7. Well, if you shut that down and now you're starting it back up, what risks might you be introducing by doing that? You may also have staff that started, in the weeks or a month before you shut down. You put them through their orientation training. They were just getting familiar with the job, and now they've been off for 3 months. And they may not be familiar. They may have forgotten a lot of what they learned through that orientation. So you may need to put them through that orientation again. So giving some thought to those other risks in the workplace that might need to be addressed as you're resuming your operations. So let's walk through each of these. Step 1, again, assessing the risk, asking questions like where do people congregate, what job tasks or processes require people to come in close proximity with one another or members of the public, what tools or machinery or equipment are people using frequently throughout the day, particularly if it's multiple people using that equipment throughout the day, and what surfaces are touched often. So really important that you give that some consideration as you're assessing the risk and really thinking about where is there a possibility of transmission of this disease. Now, this last point here around involving frontline workers, and I'm actually going to go to the next slide for this. This is probably one of the more important slides I'm going to show you today. There's a ton of fear associated with COVID and returning to work. This has impacted everyone in every walk of our lives. Anxiety, depression, stress, financial uncertainty. There's a lot going on right now, and we see it in the news. People are scared to come back to work. Are they going to be exposing themselves to the disease? So it's very important that you are involving your workers throughout this process. All 6 steps, you need to be involving your workers. Now, there's already requirements in the Occupational Health and Safety Regulation and the Act around joint occupational health and safety committees if you have 20 or more workers, a worker health and safety representative if you have between 9 and 19 workers. And if you have fewer than 9 workers, then you're still required to have involvement of your workers. It is one of the rights of a worker, which I'll talk about in a bit. But this involvement I can't emphasize enough. By involving your workers in assessing the risk and putting your control measures together, it'll go a long ways in reducing that fear. And trying to remove, or I guess increase comfort for your workers that they understand the process you've gone through and they understand the control measures and had some input into the control measures that you're putting in place. So again, I can't emphasize this enough. So once you've done that risk assessment, you understand where the risk is, we now need to look at implementing those controls. Again, how you can maintain physical distancing is first and foremost. Where you can't maintain physical distancing, then looking at other control measures, and then also your cleaning and hygiene protocols. So that then brings me to the next slide, which is probably the other most important slide that I'm going to show you today. And this, in our geeky safety world, is what we refer to as the hierarchy of controls. And really what this is showing you is the most effective controls down to the least effective controls. The most effective being at the top of this reverse pyramid, down to the least effective at the bottom. I'm going to jump to the bottom here just for a quick sec before we go through this, and I'm going to spend some time on this slide. That last, the bottom level there on the pyramid, the PPE, is the 4th level of protection. And this is your masks or your gloves or other types of personal protective equipment that people wear. And the reason I jump here first is because that's where everyone else jumps first. Employers, workers, the public, all jump to PPE as masks, really, as being, everyone talks about masks, and well, if we're wearing masks, we're all protected, and that's not necessarily the case. And this goes for all risks in the workplace, that PPE is actually the lowest form of protection. It's the least effective form of protection. It doesn't mean it shouldn't be used. There are definitely situations where it should be used, and I'll describe one of those in a moment. But we want employers, we need employers to focus on the higher levels of protection on this hierarchy before they jump to PPE as being that level of protection. I'll talk a bit more about masks when I get back down here, but let's go up to the top. So really starting with elimination. And for the purposes of COVID, what we're referring to with elimination is maintaining that 2 meters of distance. So the thought here is that if you can maintain 2 meters of distancing between people, you are eliminating the majority of the risk. That is the primary mode of transmission, is close contact between people and the droplets coming out of individuals' mouths, nose, whatever it might be, and transmitting across to another person. By maintaining 2 meters of distancing, you are eliminating the majority of that risk. And that's where we want employers to focus first. How can you rearrange the workplaces or rearrange the work tasks, maybe reschedule some of your shifts, staggered start times, whatever it might be. If you have the luxury of people working from home or working remotely, definitely an option you should consider. Possibly limiting the number of people in your workplace, looking at occupancy limits and things like that. But that is really where you need to focus your efforts first. Where are all the possibilities that you can implement as an employer to keep people 2 meters apart from each other? But we also recognize there are many job tasks out there where you can't maintain 2 meters of distancing between people. And this is where you need to start looking at engineering controls and administrative controls. So engineering controls being the next most effective, the second level of protection. And for the purposes of COVID, this is where we talk about barriers, physical barriers. So probably all of you have walked into a grocery store and seen plexiglass barriers at the checkout between the cashier and the person purchasing their food. And that barrier is actually a physical barrier where the droplets coming out of someone's mouth or nose hit that barrier and don't transmit across to the other person. It's very effective, a very effective control measure in reducing that risk as long as that barrier has been designed appropriately. And we have some guide on that, which I'll show you a bit later as well. But it isn't as effective as elimination, where you are actually keeping people 2 meters apart from each other. It's also not always practical. The plexiglass, any sort of barrier, it doesn't have to be plexiglass, it could be other types of material as well, as long as it's a physical barrier. It's not always practical. And so you also need to look at administrative controls. And these are going to be the rules, the guidelines, the policies you put in place. And an example of this, again, using a grocery store, because most of us frequent grocery stores. When you go into a lot of grocery stores now, you see arrows on the floor that go up and down the aisles, recommending that or asking people to move throughout the aisles in one direction to create flow and avoid people crossing each other or the congregation of people within the aisles. Now, the reason that administrative controls are the third level of protection is because it requires, almost all of them require the behaviors of people. So these rules that you put in place, those arrows that you put on the floor, they're great to have there. And for the most part, people will follow them, but you're going to get some people that won't. And it requires the behaviors of people, and the only behaviors you can control are your own. And how many of you have walked into a grocery store and gone up and down an aisle and you followed the arrows and someone else is coming against you and not following those rules? And that's why they are less effective than engineering controls and elimination. We then get into PPE, and I've talked about why PPE is the lowest form, but I do want to talk a little bit more about masks. Still lots of conversation happening on masks, and different jurisdictions are doing different things related to masks. In BC, we have not mandated masks. WorkSafeBC is not recommending, or I should say, strongly recommending or mandating the use of masks in certain situations. There are situations where we are saying yes, that it is something that should likely be used, and I'll talk about that in a moment. But with masks, the key thing to understand about masks is that you are potentially, depending on what type of mask you're using, you're potentially providing some protection for you, but you're mostly protecting the people around you from your own droplets. So if you are in a situation where you have more than one person in close proximity with each other, really you need all of the people within close proximity to be wearing that mask to make it effective, so that you're all protecting everyone else from your own droplets. And that's really the most effective way of the masks working. If you're wearing a mask, you're providing some level of protection for yourself, but you're more so protecting other people. I also want to make one quick comment on gloves. We're not recommending gloves for the purposes of COVID at all. Now, if you would normally wear gloves as part of your job, if you're using chemicals, or maybe you're wearing gloves because you're using sharp knives or whatever it might be, still wear those gloves. You know, we're not saying you shouldn't wear the gloves, but it's not a control measure for COVID. And we don't recommend it as a control measure for COVID. And I'll explain why. Is your skin on your hands and everywhere on your body is actually a very, very strong protective measure against viruses and bacteria. You can't absorb COVID through your skin and your hands and become infected. Really, the only way of transmission is through your eyes, your nose, your mouth. So by wearing gloves, it's not like you're protecting yourself from getting the disease on your hands. And when you're wearing those gloves, some materials actually pick up the disease off of a surface more so than your hands will, more so than your skin will. So if you're still with those gloves on, touching your face close to your eyes, your nose, your mouth, you're still transmitting the disease, or transferring the disease from your gloves to your face. The other thing is that the gloves provide a false sense of security. People think, well, if I'm wearing gloves, I'm protecting myself, and you're not. So there might be more of an inclination to touch your face when you're wearing gloves. So we don't recommend gloves for the purposes of protecting yourself against COVID. It's not to say you can't wear them, but you need to be very cognizant of that fact. And you still need to be sanitizing and washing on a regular basis to ensure that you are removing and neutralizing the virus that might be on those gloves. Okay, so that was a lot. I know it's a lot of information there. We can definitely open it up for questions as we move forward, but let's move to a couple other examples. And I do want to come back to the masks here, because this is an example where masks might be appropriate. And it's an easy example for people to understand, which is why we use it. And there's also lots of situations where workers have to travel in vehicles as part of their job. And it might be multiple workers in a vehicle going up to a construction camp or a forestry camp. It might be members of the public in a vehicle, maybe, you know, and particularly in the sea to sky, where tourism is such a huge business. Maybe you're transporting the public in a van up to a place up the mountain to do an ATV tour, or whatever it might be, or go bear watching or whatever, or maybe whale watching out in Squamish. I mean, there's so many situations where you're going to have people in a vehicle. Now, if your vehicle is large enough where you can maintain some physical distancing, if you're in a van or a bus, you should focus on that first. Can you spread people out in the vehicle so you've got as much space between people as possible? That's great. Physical barriers can work. You've probably seen it on buses where there's sort of these curtain type barriers that are between the driver and the ridership. That can also work, but you need, if you're thinking about barriers in a vehicle, you need to make sure you're complying with the Motor Vehicle Act as well. So you don't want to contravene the Motor Vehicle Act. But this is a situation where if you have multiple people in a vehicle, you may want to consider masks. If you can't maintain that 2 meters of distancing, and if barriers won't work, you might want to consider masks. But again, for it to be effective, really everyone needs to be wearing a mask. And there may be people that can't wear a mask for whatever reason. They might have medical reasons, or they might have religious reasons why they can't wear a mask. So really important that you consider that as well in the protocols that you're putting together. Now, cleaning and hygiene, while we're on the topic of vehicles, cleaning and hygiene is really important. So if you have multiple people getting into a vehicle, you want to have wash stations as you enter and as you exit the vehicle. Also looking at your cleaning practices. So on a regular basis throughout the day, or at least once at the end of the day, ensuring that you're cleaning the door handles, the seat belts, the steering wheel, if you have multiple people driving, the shift knobs, the turn signals, the windows, that type of thing. So really considering your cleaning and hygiene practices. And that brings me to the next slide around cleaning and hygiene, that developing your protocols for cleaning and hygiene is really important. So ensuring that you're robust in the way that you put this together. It might be much more robust than what you've had in the past. You know, providing adequate hand washing stations for your workers, ensuring they're easily accessible, having policies in place around when people should be washing their hands when they arrive at work, before and after breaks, after handling cash or other materials, before handling common tools or equipment. Ensuring that you have reminders up around personal hygiene, so posters or in the break room, for example. Supplying items like soap and water, hand sanitizer, disinfectant wipes, nitrile gloves and garbage bags for those that are going to be doing the washing or the disinfecting and the cleaning. Implementing your cleaning protocols for all commonly touched surfaces. Again, I talked earlier about washrooms, equipment, tools, desks, light switches, door handles, things like that. And then removing unnecessary items. And, you know, I talked earlier about food, not sharing food and drinks and utensils, but also looking at things like coffee makers or shared water jugs, water dispensers that you may have in your work site for the public. These are nice things to have and good from a customer service perspective, but you might want to consider removing them. Or if you really do want to offer food or drinks to your patrons or to your staff, think about changing the way that you're doing that. Having single servings, and I know it's not as environmentally friendly for sure, where, you know, having a big 40-liter water jug that dispenses water versus having individual water bottles isn't the best way to go from an environmental perspective, but you do need to consider the frequently touched surfaces. Or if you've got if you typically have muffin trays out, instead of having those muffins just out in the tray, maybe you have them individually wrapped, or you have granola bars instead of muffins that are individually wrapped, something along those lines. And then with your cleaning and cleaning and hygiene protocols, you want to make sure there's training, supervision, and documentation, which actually goes along with all of the policies that you're going to put in place. Which then brings us to step 3. So you've done your assessment in step 1. You've implemented your control measures in step 2. You want to ensure you have policies to back all of that up. The policies are really important. So I talked about the policies around when you would expect your workers to wash their hands. You're going to have policies around cleaning and hygiene, how frequently that's going to happen throughout the day. You should have policies around who should or shouldn't come into the workplace. You should have a policy that states if your workers are experiencing signs and symptoms, they should not be in the workplace. If your workers have been out of the country in the last 14 days, they should not be in the workplace. You should also consider policies for the general public. You should look at screening measures. If you're a hair salon or a nail salon, maybe calling your patrons the day before or the morning of their appointment and saying, you know, have you been outside of the country in the last 14 days? Are you experiencing any signs of symptoms? If they're answering yes to these questions, you should be rebooking their appointment. They shouldn't be coming into the workplace. If you have the capacity, asking those screening measures as people enter into the workplace, as the public comes in. So things like that are important policies to consider and will help to back you up as an employer if you run into issues moving forward. Step 4 is around communication and training. So I mentioned earlier the importance of including your workers, but not necessarily all your workers will be involved in putting together the plan. So you do need to ensure you communicate that plan out to all of your workers, that they're aware of the risks, they're aware of the control measures you put in place, they're aware of the policies, and they're trained on any new protocols that are necessary. Posting signage can help here, and then also ensuring supervision and monitoring throughout. Step 5, I kind of talked about already. It's really that plan, do, check, act approach, ensuring that you have an avenue for your workers to bring forward any concerns they might have, any issues they might find with the plan you've put in place, and then making modifications as necessary. And step 6, also not much more to say here, just ensuring that you're considering those other risks in the workplace. COVID is not the only risk going on right now. There are other risks in the workplace that can cause serious injury, illness, disease, death. And it's very important that you as the employer continuing to turn your mind to those risks. Those risks likely haven't gone away just because COVID has appeared. So ensuring that you are putting some effort into that and continuing to protect your workers from that perspective is important as well. So we have a template on our website that walks you through these 6 steps. You don't have to use our template. You don't have to use our 6 steps, but it does lay out the 6 steps in a checklist type format, fillable PDF that you can use. You might notice in the bottom right-hand corner that the little image there says page 1 of 9. Try not to be too overwhelmed by that. A lot of it is blank space for you to type in your responses within each of the steps. And the bulk of that, again, is in step 1 and step 2. So we do recommend you look through it. Officers are going to expect that you've gone through the 6 steps, that you've considered the 6 steps. So here's a template that you can use. Now, I should have also mentioned, you will get copies of this PowerPoint in a PDF format afterwards. And all the links that I have on all the slides are available to you. There'll be live links. So the link on this slide takes you right to our COVID safety plan that you can download and utilize if you haven't put your plan together yet. So you've got your plan in place. It's also important for you to understand that workers have responsibilities in this as well. They also have some rights. In terms of responsibilities, they need to know when not to come into work if they have signs and symptoms, for example, or been out of the country in the last 14 days. while they're at work, they need to follow the measures you put in place, complying with any of the instructions you've developed, practicing physical distancing, cleaning, disinfecting, personal hygiene, and so forth. And then even when they're outside of work, although you don't have control over this as an employer, it's incumbent on all of us in the public to be minimizing our exposure everywhere we go. And that includes outside of the workplace. Now, workers also have rights, and they essentially have three rights, three main rights: the right to know about hazards in the workplace, the right to participate in health and safety activities, and the right to refuse unsafe work. Those first two are really covered by including your workers in the process of developing a plan and communicating that plan in step 4. The third one, around right to refuse unsafe work, it's important for you as an employer to understand that process, that if a worker comes forward and says, look, I don't believe that you've done enough to protect my safety, you are required as the employer to investigate that situation, work with your workers to try and resolve the issue. There's a number of steps laid out in the regulation that will walk you through that. If you can't come to resolution, then either you or the worker can call WorkSafeBC, and an officer will come out and walk through that with you. But the officer will expect that you have tried to resolve that issue yourself between you and your workers. So important that you understand the right to refuse unsafe work. Many of you out there probably have not experienced this issue before, but may experience it now with COVID. And again, it goes back to that fear of people coming back to the workplace. All right, a few slides left to go, and then we'll open it up for questions. So how do you develop your plan? Where do you get information to develop your plan? We've got a ton of information on our website, and I'll show you a link to our website. But this here gives you a listing of all the protocols that we have on our website. Phase 1, and this follows the restart plan that was put together by the provincial government. Phase 1 is there are those essential services, those businesses that for the most part continued to operate during that March, April, May period. Phase 2 and 3 are those industries that either were forced to shut down or chose to shut down and are starting to resume operations in Phase 2 and Phase 3. So we have protocols and guidance for all of these industries. Now, you may be looking at this list saying, well, my industry isn't there. It doesn't mean there aren't protocols on the website that will help you. And we do recommend that if you don't see your industry listed here, that you go onto our website, you think about what industries might be similar to mine, and you go in and look at the protocols and see what you might be able to find to help you. There's 550 industries just in our classification system, WorkSafeBC in this province. We don't have the capacity to be able to develop protocols for all 550. But what we do feel is we've covered a cross-section of industries where there are protocols on there that will help most businesses, if not all businesses. And if you can't find what you're looking for, call us and we will help you. So what I want to do here is, and I'm just going to kind of thumb through a couple examples of what type of information is found on the slides as I talk. What you see on these slides is a listing of categories. And when you go on to our slide, for this one example, if you go on to transportation, you click on, what you'll see is drop downs for all of these. So you click on courier and delivery services, and you'll see a bunch of protocols come up on what you can consider as an employer. It's important to know, though, that these protocols and guidance are not requirements. We can't write you an order if you don't implement one of the protocols that we have on our website. They're meant to be guidance for you. They're meant to be thought starters for you to give some consideration to putting together your plan. But they may not be practical for you, and that's fine. You need to consider what's practical in your environment, in your business, and help to put together your plan. And I've just chosen some topics here that I think would be applicable to your industries. What I would guess are a lot of industries that would fall in the sea to sky corridor. And then what I've done here at the end with restaurants, cafes, and pubs is I've given an example of some of the protocols. We've got a lot more than this for restaurants, but some of the protocols that we have on our website, just to give you an idea of how we've worded them. They are fairly high level, but the first one there, position seating, so that customers are seated 2 meters from other tables and a maximum of 6 people per table. That's actually in the order that's on the Provincial Health Office website related to restaurants. So where possible, we have listed the orders on our page. Not always though, so again, please do read those orders, but that would be an example. And then we've listed some other protocols to consider. So the third one down, for example, have servers leave food and drink at the front of the table and let guests pass them down after the server has stepped away. Again, you don't have to do that. It's not a requirement. You're not going to get written an order from an officer at WorkSafeBC if you haven't done that. it's something for you to consider. If it's practical for you to help to maintain the distancing, if your layout allows that to happen, and I've been in a restaurant myself where they have done this, and they have a section of the table where they don't allow people to sit. The food gets put down on the table at that point, and then the patrons sitting around the table deliver their own food to each other. So something to think about. So that's kind of how we've mapped them out. They're fairly high level. They're meant to be thought starters to help you put together your plan. Now, I'll show you how to access the various resources, but I do want to talk about a couple areas where we get a lot of questions. The first one, which I thought would be quite applicable to your region, being, again, the sea to sky, very high in tourism. You get a lot, particularly during the ski season, a lot of foreign workers coming and working within your work settings. I thought I would talk a little bit about employment status and temporary work. So it's important to, first of all, understand that regardless of whether your employees are full-time, part-time, temporary, or are participating in a work sharing program, they do fall under the Workers' Compensation Act and Occupational Safety Regulation, and therefore everything we're talking about today also applies to them. So it doesn't matter whether you have all temporary foreign workers, you still need to have a COVID safety plan that protects them as workers. Now, it's also important to look at other resources that are available. So before hiring, ensuring that they're not exhibiting any signs or symptoms, not violating any mandatory self-isolation orders. So again, they should have self-isolated coming into Canada, coming into BC for at least 14 days. For temporary foreign workers, you can access some additional resources on the Government of Canada's website that I have linked there. Adding COVID prevention to your regular employer orientation, training, supervision, and equipment policies. So that really falls into the 6-step process. And then considering if you need additional documentation and work records. So there is some guidance on the Government of Canada website that I recommend you take a look at. I also want to talk about psychological health and safety for a moment. This is a frequent question that we get, frequent topic that comes up. And again, it really goes back to that fear that I talked about earlier. But there is a lot of fear on returning to work. This COVID has impacted everyone in every walk of their lives. Again, the anxiety, the stress, the uncertainty of the future. And it's important that workers pay attention to psychological health and safety. It's just as important as physical safety. And you do need to put measures in place to protect the psychological health and safety of your workers. So we've got a number of links there, mostly external resources, where you can download posters, you can download toolbox talks or videos that you can show your staff. There's opportunities for webinars for them to go through. Lots of great resources out there to help you, but it is something that you should turn your mind to as an employer. Now, working from home, not everyone has this luxury, but where you do have the ability to allow your staff to work from home, we do recommend it as again, part of that hierarchy controls, elimination, keeping people apart from each other, having them work from home is a good measure. Most of us at WorkSafeBC are still working from home, other than some of the essential services that have to be in the office. So I'm talking to you today from the den in my home. But it's also important to understand that as an employer, you still have a responsibility for the health and safety of your workers, even if they're in the home environment. So having a policy in place is important. Ensuring that your workers have gone through a hazard and risk assessment process in their home environment, ensuring they have evacuation and emergency preparedness measures in place, looking at ergonomics, and I have a slide on that in a moment, education and training, check-in procedures, things like that. So it's still your responsibility as an employer. If a worker gets injured while at their home doing their work duties, in the course of their work duties, you are still liable for the claim that might get accepted. If a claim gets accepted, that's on you as the employer. So it's still your responsibility as the employer to ensure that health and safety measures are taken into account if your workers are working from home. And we have, we're not saying that you need to go out to your workers' home and do an assessment. There's probably some privacy issues there, but have your worker go through their own hazard ID and inspection process, and then maybe talk to them about it over the phone or over Skype. And we've got some links here that will take you to a checklist type format on how you can do that. I also want to talk about ergonomics. It really is the primary source of injury in the home environment. Other than maybe the emergencies like fire or a medical emergency, we're really talking about ergonomics. How do you set up a computer workstation in a safe manner? So we've got a resource there linked at the bottom of the page, some excellent information, very easy to go through. You should be familiar with it as an employer, and then also your workers should be familiar with it as well. And I do want to just draw your attention to one point in the middle there around the breaks and micro pauses. It's very easy in the home environment to roll out of bed, come down to your office, your den, wherever you might be, sit in front of the computer and not come up for breath until dinner time. It's not safe, it's not healthy. It's important that you're taking breaks throughout the day. We do recommend the 20-20-20 rule. So every 20 minutes, you're standing up for 20 seconds and looking at least 20 feet away from your monitor. And that allows your eyes to relax, allows your muscles to relax, maybe do a few stretches, and then a couple times throughout the day taking a longer break to get some snacks or go for a walk or whatever it might be is really important to consider and can be more difficult to implement when you're in the home environment. All right, last couple slides. Where do you get the access to all these resources? So this is a picture of our front page, our home page. If you click on the blue shaded area with the picture of the virus, it'll take you right to all the COVID protocols that I showed you earlier. If you can't find what you're looking for, give us a call. And this is the slide where I said we had some phone numbers. So bottom right-hand corner, if you're in the Lower Mainland, 604-276-3100. For most of you, you're likely going to be calling the 1-800 number. So 1-888-621-SAFE or 1-888-621-7233. Give us a call. We have officers on the other end of the line. We're answering the calls within 30 seconds. And usually the response time is somewhere in about 80 minutes to provide you with a full response to your query, give or take, depending on how complicated your question is. But we are here to help. Even when the officers come out and do inspections, again, we have 300 officers. I've got about 25 consultants on my team. We are contacting employers every single day, helping, asking what challenges you're running into and putting together your plan. We are really taking a consultative approach to this issue. And we're there to help you. And so don't be scared if you get a call from WorkSafeBC. We are really taking a consultative approach. Having said that, if you're clearly not doing your due diligence as an employer, and you're clearly not putting together your COVID safety plan, and you're not including your workers in that process as required, then you may get written an order. And so just to give you an idea, there's been over 12,000 inspections, COVID-related inspections, since we started back in March, April, and we've only written about 320 orders of 12,000. So it's a pretty small number of orders being written, but there is a possibility that an order may be written if you're not doing your due diligence. So going through those 6 steps, putting together your plan, considering the safety of your workers is really important as you move forward here. And again, if you've got challenges, give us a call. I've also created, I'm not going to go through all of these, I've created a page here that just has a bunch of links to other resources that I thought might be helpful for you. It directly links to those resources on our website. So how to use a mask, how to select the appropriate use of masks, how to design effective barriers, hand washing posters that you can download and put up, occupancy limit posters, things like that. So great resources here that you can link to. We have all of our claim services available right now. So we've got the phone numbers there on the page. We've also got a COVID claims FAQ document. So we've often had questions around COVID specific claims. There are some of them. Again, most of them are happening in healthcare where it's more apparent that COVID is actually in the workplace and that the disease resulted from the workplace. It's a very high test right now. So again, for an acceptable claim, it has to be proven that the worker conducted or contracted the disease in the course of doing their duties in the workplace. So it is a very high test, but if you have questions about that, there's an FAQ document on our website, and then you can give us a call. Some additional resources. We got the BC CDC, the Office of the Provincial Health Officer, BC Health Link. You've also got the self-assessment tool there, a phone number if you have any questions, non-medical questions around COVID, and then 811. We also recommend that you connect with your health and safety associations. So all 12 of them are listed there. In particular industries, there's industry employer associations like your chambers of commerce, labor organizations. Small Business BC has been an excellent resource that we've tapped into and have great resources on their webpage. And then federally, there's the Canadian Centre for Occupational Health and Safety, which is also quite useful. It's not specific to BC, but still some very useful resources. And that brings me to the end. So before I hand it back over to you, Melissa, I just want to mention I've got 2 email addresses there on the last page. You've got my email address. I can guarantee that my response time is not 30 seconds. So if you're looking for a quick response or you have a very specific question, you're best to contact those prevention lines that are provided to you earlier. But if you have a question about anything I've said today, or if we don't get to your question during the Q&A period, feel free to email me. I've also included the consultation services at worksafebc.com email address. That's the general email address for my team. I have a team of about 40. We typically work more so at the industry association level. But if you have a question there, you're more than welcome to email us. But really, if you've got a question specific to your plan, your quickest response is going to be giving us a call through our prevention information line with those numbers I outlined earlier. And that brings me to the end. So Melissa, I'll hand it back over to you, and we can see what we've got as questions.
That was loads of information. So thank you for that, Chris. So I got a couple questions here. The first one up is, I think you did talk a little bit about this, but maybe you can expand on it a bit more, is the, can you please let us know what an inspection might look like?
Yeah, and I did touch on that a little bit at the end, but I will talk a bit more about that. So first of all, you may get a call from WorkSafeBC for a number of different reasons. You may be getting a call from our assessments department because they have a question about your insurance. You may get a call from my team. As I said, we're calling employers more of a consultative approach. My team doesn't have the authority for enforcement of the regulation, but we are taking a consultative approach, seeing what issues you might have. But if you do get a call from WorkSafeBC, and it is an officer, they will tell you right away that they're an officer and they're there to do an inspection. We're doing a lot of them virtually, but we are also out there doing them face-to-face. So you may also have an officer show up at the work site. They do not have to announce that they're showing up. They could show up randomly. We are very cognizant of the fact that there's a lot of stress right now with businesses resuming operations. So, you know, if it's really not the right time, then you can let the officer know. But they are going to judge that based on what they're seeing as well. So they may come back at another time, or they may say, no, we're going to do this inspection now. When they do the inspection, they're really going to be asking you questions around, have you gone through the 6 steps? You know, are you aware of the 6 steps? What process have you used to include your workers? They may even ask to speak to someone on your Joint Occupational Health and Safety Committee or your Worker Health and Safety representative. To verify that workers have been included in the process. And then really they're going to open it up and want to help you with any challenges you might be faced with. They're going to help direct you to the resources on our website or the resources of the health and safety associations or other industry associations. And if needed, as I said earlier, they will write an order. If they write an order, it's not like you're going to necessarily be shut down. They do have the ability to shut you down, but that's very rare. So, it's really meant to be an educational process. They write that order to make sure you understand what you need to do. And then you'll have some time to comply with that order, typically about 30 days, but it does depend on the risk. You'll have about 30 days to comply with that order, and the officer will follow up with you and see if you have any questions or concerns and help you through that process.
Right, and I can just imagine that, speaking anecdotally, of course, with some of my members, many of them, especially retailers, restaurateurs, right in the main hub that we're in Whistler, so I can only speak on behalf of the Whistler community, but for the owners that were prior to COVID, were not all totally involved in the operational piece. All of a sudden, they're now into that whole operational piece, having to look at how to reopen and all the procedures and all of this. It's a lot to undertake. So really appreciate that WorkSafeBC is actually going in more on an educational start to help and educate. And then if those protocols still aren't in place, then put the hammer down.
Yeah,
for sure. No, I understand that. That's great. I think the second question then would have been answered, which is really, are the protocols, the BC WorkSafeBC protocols enforceable? I think we've answered that one as well.
Yeah, maybe I'll just take a moment on that, Melissa. So just a bit more clarity there, that when you go onto our website, you see all those industries and you click on the drop down, it has the list. What you see on those lists, again, those aren't enforceable. Again, we can't write you an order because you didn't put the food down at the end of the table and have people pass it to themselves. We can't write you an order on that. But what is enforceable is what's in the regulation. And I really want to draw employers' attention to Section 21 of the Act, which is general duties of the employer. And under those general duties, it does state that employers do need to protect the health and safety of their workers. So if you're not putting a COVID plan in place, that's where you will be likely written the order. You'll be written an order under those general duties to say you have not complied with general duties. You need to put a plan in place, that type of thing.
It's interesting because one of the pieces that you had mentioned was even looking at the safety of workers working from home. Our team at the Whistler Chambers, everybody's working from home. And I have to be honest, I had not considered actually having to do that. And I would suspect that many others working from home are in the same boat as myself. So that was a nugget that I will take seriously and take a look at with the team. Jackie Bastillion works in both Squamish and Whistler, so she has a question. If you have clear policies in place for your clients, such as wearing masks, max people per table or spaced out lineups, and some clients refuse to follow them, what are some of the enforcement tools available to the businesses? That's a tough one because I've heard that happening.
Yeah, it is a tough one, and there's sort of multiple jurisdictions coming into this as well. Some of that is a public health issue as opposed to a WorkSafeBC issue. So I can speak to it from the perspective of worker health and safety, which is our mandate. So when you think about, let's use a nail salon, or let's use a hair salon as an example. If you've put a policy in place that you want your patrons to be wearing a mask while they're getting their hair cut, and they refuse to wear one, that is a risk to your workers. Now, you may have other protocols that you can put in place that as a business, you will still be able to protect your workers even if the patron isn't wearing a mask. You're also probably going to find some patrons, just as I said earlier, they can't wear a mask for religious reasons, for medical reasons, whatever it might be. So you might need to look at some alternatives on how you can protect your workers while still offering that service. But I also want to say that part of the fear of workers coming back to work, there's also the fear of the general public going back and utilizing businesses. People have fear of going and getting their hair cut because they don't want to be exposed. They have fear of going to the grocery store because they don't want to be exposed. So by setting policies and sticking to those policies, you're actually going to create a lot more confidence, consumer confidence, to want to come back and utilize your services. So if someone outside, if you set up tape outside your door of 2 meters apart from each other and someone just is not complying with that, and you go out and ask them to respect the policies you put in place and they refuse, you can ask them to leave. And you're not going to serve them as a patron. Now, there's some risk there because now you're potentially getting into a violent situation or something that could escalate, which creates other risks for your workers. So you need to be careful as an employer on what you're encouraging your workers to do or what stance you're going to go on this. But from a consumer confidence perspective, sticking to your policies actually can go a long way of creating more confidence for people to want to come back and start using your business again.
Yeah. No, and I understand that. I've heard through some of the experiences that our businesses have gone through, especially last weekend was the busiest weekend we've seen since COVID hit. And there were several cases of individuals not wanting to line up properly, and then the staff having to go out and discuss that with them. So I think that's something that we're going to continue to see, and it's really around ensuring that the owners or the business managers and the staff understand how to manage those potential issues that might come up. That makes sense. There's another question here on what are the differences between WBC inspections and COVID-specific VCH inspections that are occurring at the moment?
Sorry, I missed the last bit of that. So the difference between WorkSafeBC inspections and which inspections?
It says COVID-specific VCH, Vancouver Coastal Health inspections that are occurring at the moment.
Right. So yes, there may be inspections that are occurring from the public health office, the local health authority, through bylaw officers. So maybe if I can explain the difference between the two is the orders that you would find on the provincial health office website, WorkSafeBC cannot enforce those orders. Now, the only order that they have allowed us to enforce is the fact that a COVID safety plan has to be put in place, because they've actually named in there that it's a requirement of WorkSafeBC. So yes, we can enforce the fact that a COVID safety plan has not been put in place. But in the restaurant's order, for example, in the restaurant's order, it states that, now it's been updated a number of times over the last couple of months, but it states that you can't have more than 6 people at a table. WorkSafeBC can't write an order on a restaurant because they might have 7 people at a table or 8 people at a table, because we actually don't have that within our regulation. We could potentially write an order because the COVID safety plan isn't actually following. I mean, it's a bit of a gray area there, but when the provincial health office is coming out and doing orders, they're really looking at the compliance with the orders from the provincial health office. So the mass gatherings order and the restaurants order and those other orders. So that's really the difference in what you're going to see. But there's absolutely a possibility that an employer could have an inspection done by both organizations.
Done by both. Wow.
Yeah.
That's quite a bit. So there aren't any other questions. I'll leave that there for a minute here, because I know that we've got lots of people on the line. So if there's any other questions, please feel free to put them in. I'll give you a couple minutes to do that. In the meantime, I've been writing some notes while you were talking, and one of the pieces that I work on all the time is the computer workstation. And I'm in my kitchen with a hard wooden stool, thinking this was going to be temporary, and I'm still sitting on my hard wooden stool on a countertop. So I really like the idea of the 20-20-20 rule, but I'll have to start that after my 3rd webinar back to back today at 1 o'clock.
Yeah. I hear you. Yeah. So,
but
yeah, well, and one question we actually do get a lot on this, Melissa, is, is it a requirement of the employer to then provide an office chair for their worker in the home environment, or any other equipment for that matter? And it's a good question, and it's unfortunately this question is it depends. There's nothing in our regulation that states that if you have a worker working from home, that the employer has to ensure that they provide them with a desk or provide them with a chair. Having said that, though, as I said earlier, the employer is on the hook. If someone's at home and they get injured, and musculoskeletal injuries take time to manifest. They can take months where, that sore back or that sore shoulder, that sore wrist, it's not going to be apparent right away. It could take months before it really starts to manifest. And if a worker feels like they have been injured because they're working at their computer workstation at home and they submit a claim and the claim gets accepted, the employer is on the hook for that.
He's on the hook.
And,
well,
the average claim cost is somewhere, and this is just average, is somewhere in the range of about $5,000 to $10,000 for an ergonomics or an MSI type claim. Many of them can go much higher than that. So it's important for employers to justify that. So I would say, at the beginning of this, where we all went home, just as you were describing, thought, oh, this might be for a few weeks or a couple of months. And now it's looking like for us, at WorkSafeBC, we're talking about, the fall or maybe even 2021 before we're back in the office. The employer does need to give a bit more consideration to that, and work with you as the workers to determine what that's going to look like. It's not a black and white situation. It really does come down to a situational discussion that's going to have to happen between the employer and the workers.
Agreed. Which in our situation, I can only speak on our behalf because I know what our office situation is like, is that there are desks and chairs that can be moved into their home space. And I would suspect that many other offices might be in the same boat. So I know my team's listening, so
yeah.
I'm like smart. It just
yeah. Fair enough.
No, that's fair. I mean, it's all very new to all of us. So this whole work from home thing is enjoyable.
So we were all at WorkSafe. And if we were all after we realized this was going to be longer than just a couple of weeks, we were all allowed to go back and grab our chairs from our office, and bring it home. And so there's some concessions there that you kind of need to consider as time goes on here, for sure.
Yeah, agreed. Now, I haven't seen any movement in the Q&A. So what I'm going to do is maybe ask if you have any closing remarks that you'd like to make, Chris, and then we can just close out the meeting for this morning.
Sure. I think first of all, I want to thank you, Melissa, the other chambers, the BC Chamber of Commerce that helped set all these up as well, just for having us do these. I mean, again, I've done about 40 of them as an organization. We've done probably close to 75 or 80 of them. It's been a huge benefit to be able to have this virtual platform to talk to employers and provide the service, provide some information. But it's a lot of information that I've talked about in the last 45 minutes, and it can be very overwhelming. And we don't mean to make it overwhelming, but at the same time, employers need to actually dedicate some time to this. If you think you're going to be able to go through that risk assessment and put together a plan in 5 or 10 minutes, that's not the way this works. It's going to take some thought. It's going to take some dedicated time for you as an employer to do this. And so when you go to our website, you'll see a ton of information. Just take a breath, digest what we've got on our website, go through the protocols, dedicate some time to read what we have there, and then start to put together your plan and bring, as I said, bring your workers into that conversation. It can be overwhelming, and I get it, and it's a stressful time for everyone. But try and dedicate some time to do that. And if you have questions and concerns, give us a call.
No, that's really great. So like I said, I did some notes here on as you were talking, and some really interesting. The symptoms and transmission risk factors were quite interesting to go through. Some of them I think we kind of know, but there's a lot of questions around masks and gloves. And so thank you for going through that. And then of course, the biggest thing is developing the COVID safety plan requirements, considerations for the employer. So, you know, we've been talking to our employers to make sure that they understand, so important for the team, their team, to understand what they are and feel that safety before they enter the work premise, so that they can then what am I trying to say? It then translates over to the consumer, which then helps your business, right? So if the staff aren't feeling confident, the consumers certainly aren't. And when we look at recruitment and retention strategies for employees, that's a huge factor right now. I can tell you, I have a 24-year-old that I work with, that I live with, my kid, and she works for an incredible company that has all of that, and they feel safe. They feel really good about going to work, and I've heard others that just won't do it. So really important for the businesses to understand that how important that is. And then the mental health, we work closely with the Whistler Community Services Society here in Whistler, and the numbers for them have gone through the roof. And it's so sad to hear that. I'm thankful to see a lot of webinars on there, free webinars and access to information. So for those of you that are listening and will listen later, please do contact within your community, the community services programs, because they're there to help. And they're there to help you and your staff, and make sure your staff are aware of that as well. So this webinar has been recorded, so you can go back to it at any time, and it'll be placed on each of the Chamber's websites, so whether it's Squamish, Whistler, or Pemberton. And then on behalf of the Pemberton, Squamish, and Whistler Chambers and the BC Chamber, thank you, Chris, and WorkSafeBC for being with us today. It was great to hear from you. And thank you, of course, to all our Chamber members who participated today or will watch this in the future. So we very much appreciate your continued support and hope that this information has been beneficial to all of you. So lastly, thank you to the BC Chamber and our partners in Squamish and Pemberton Chambers, and all the members that are out there for collaborating with us to put this event on. So as our fearless leader, Bonnie Henry, says every time she speaks, be safe, be calm, be kind, and have a wonderful week. Thank you, Chris.
Awesome. Thank you very much, Melissa. Take care, everyone.
Take care. Bye, everybody.